In this video, we will briefly cover why fasting and intermittent fasting is actually an excellent idea if you struggle with chronic back pain. Before we get into it, do myself and yourself a favor and subscribe to this channel because you're going to find a lot of content for chronic back pain that you won't see anywhere. This is because I struggled with chronic back pain for more than 10 years. I went through a lot of pain and I learned a lot of important lessons that, again, I haven't seen anyone else share. So subscribe to this channel and you're gonna see exactly how to get out of this hole. Now, fasting is pretty good for chronic back pain generally because of inflammation. Whenever you eat food, your digestive system is gonna try to digest it, and that's gonna result in all of these metabolic byproducts. And that results in increased levels of inflammation. Inflammation is a natural process, we should have it in our body, but when the levels go too high, you can find that chronic back pain is actually increased. And when we digest food, a lot of free radicals and toxins also get released. There's a lot of chemicals and pesticides in the foods today as well. Also, that causes an increase in inflammation. And on top of that, both digestion and all of these, getting rid of all of these metabolic byproducts and free radicals and toxins, it costs the body energy. Now, you may think of when you eat foods, you're essentially giving your body energy. So what's the problem here? Obviously, digesting the food cannot cost as much or more energy as the food as the energy that we intake with the food, right? It's not going to make sense. But the problem is that we kind of have a little bit of a limit when it comes to energy input. You've probably noticed that you cannot really eat unlimited amounts of food. First of all, you get physically full, like you fill up your capacity of your digestive system. But other than that, you even start to feel slowed down. You've probably noticed this after a big meal. You start feeling really lethargic and your energy levels drop. So there is a limit. You cannot just eat and eat and eat and just have more and more energy. It doesn't work like that. And chances are, for a lot of us, especially in the Western world, we already have a lot of our storages of energy filled up. You're probably gonna notice, I don't know, maybe you cannot see on the camera here, but we all have a little bit of body fat. And if you're above the body fat percentage, that's considered healthy. Usually if you step into overweight territory, so this is usually 20% for men and 30% for women, or maybe something along those lines. If you have more body fat than that, essentially your body, it doesn't really need nutrition urgently. It's still a good idea to gradually decrease and maybe decrease the caloric input and lose a little bit of weight over time. But you can actually go a lot of time without food, and your body is not even going to protest here. It's really not going to have any problems. Maybe for the first few days of adaptation, maybe if it's used to eating a lot of food, a lot of intake, which actually results in a lot of waste as well. Your body gets less efficient in digesting the food and releasing the energy from it. But after the first few days, you're going to find that your body actually kind of prefers to run on a little bit less fuel, and it becomes more efficient. This is how our bodies are built. We're not really created to run on a lot of food. We can actually extract a lot of energy and other good stuff from the food if we don't overeat. And this is where back pain comes in. Healing also takes energy. All of these tissues that need repairing, the nerve damage, maybe possibly disc damage, everything that's causing you pain in your back also costs your body energy. Regeneration costs energy. That's why you always get recommended to rest and to eat plenty of healthy foods. You need to supply your body with the raw materials that it needs to rebuild itself. And now the more energy your body expends on digestion, the less energy it's going to have for repairing and healing. And a great signal to follow here is actually your energy levels and your tiredness. If you start measuring your back pain levels, for example, but also your energy levels, you're going to find that they are really strongly related. And the following example is a really common scenario. So let's just say that we use a scale from 0 to 10 to measure both back pain and energy levels. Let's say you measure like this before every meal. And this is actually a really good idea. If you do this, you're going to quickly discover exactly how you should eat. So let's say maybe you suffer from a little bit of chronic back pain. Maybe you're at a 5 before you have some meal. And maybe your energy level is also 4, let's just say. You're kind of getting a dip in energy. And you're thinking okay, I'm hungry, I'm tired. I should have a lot of meal, like a lot of food to eat and increase my energy levels. What you may discover is that, especially if you overeat or if you eat the wrong foods, is that your back pain may increase easily. Like this can often happen, and you've probably noticed this yourself. Like if you eat, especially like a meal that's full of carbohydrates and junk food, your inflammation level shoots up, and this increases your back pain levels as well. But also you're tired, even your energy level starts to drop. You expected like your energy to rise, but actually the opposite happens. And this is even the case with smaller meals. Like you don't even have to overeat when it comes to energy. You'll probably notice that even if you have a small meal for the next like 30 minutes, you're kind of like you're slower a little bit, you have less energy. So food and digestion costs energy, which is why it's a really great idea to fast. Intermittent fasting or 1 meal a day strategy, or even fasting for a few days, maybe like 1 day or maybe even 3 days uninterrupted, you're going to find this to be extremely useful and beneficial when it comes to reducing chronic back pain. And on a related note, a lot of foods actually are really difficult to digest for a lot of people. You may not even know this, maybe you haven't paid attention, maybe you haven't really tested things. But if you use like the method that I described before, and you start like kind of eliminating certain foods from your diet and seeing how they impact your back pain levels and your energy levels, you're going to quickly discover that some foods, typically the foods that are difficult for you to digest, also cause an increase in back pain levels. In fact, that's the exact reason why a lot of digestion problems, IBS, stuff of that nature, often goes hand in hand with chronic back pain. And you can actually address both of those problems, but especially chronic back pain, if you fast, essentially. Just reduce the feeding window that you eat every day. So maybe like postpone the breakfast for a little bit later and maybe have dinner a little bit sooner. This is also probably going to encourage you to eat a little bit less, because typically what may happen is, let's say you start fasting and you have breakfast a little bit later. Maybe you're going to get a little bit more hungry. And then you're going to probably overeat. You're going to have a really big breakfast. And this is going to be a mistake that maybe you repeat a few times. And then you're going to notice like, my energy levels is like destroyed after this big breakfast. I'm useless for the rest of the day here. So you're probably going to have starting having smaller breakfasts. And then because you kind of had the first meal later in the day, and you have the last meal like closer to the first meal and to the first few meals, actually, you're going to find that the last meal also you don't want to really overeat. You cannot, like, you're pretty much satisfied. You can only have a smaller normal meal. And that's why fasting is going to also reduce the amount of food you intake on a daily level. And all of this ties back into chronic back pain. If you eat less often, if your body spends less time digesting food, less energy, it doesn't have to combat with all of these like free radicals and toxins and pesticides, which of course means if you clean up your diet, if you don't eat junk food, processed foods, trans fats, carbohydrates, processed sugars, if you eliminate all of that, you're going to find that chronic back pain drops significantly and almost immediately. And of course, if you're overweight and if you drop a little bit of weight, you're also going to notice that back pain reduces. And this one is actually pretty logical. The pressure on your spine, on your discs, on your joints is going to be less, obviously. You have less gravity pulling you down when you're lighter. And also, you're going to have lower inflammation levels in general. This is all great for chronic back pain. In the next video that's going to appear above me, we're going to go over exactly how to lose weight when it comes to chronic back pain and reducing it. I will see you there. And until next time, be brave.